Hello, my name is John Armstrong and I'm the Chairman and CEO of Lead Horse Technologies. Lead Horse is a health IT company developing drug safety information tools for the wholesale health IT market. What I'll be addressing today is our Ardvarc artificial intelligence-driven pattern recognition technology. The problem we address with Ardvarc is that of adverse drug reactions and alerts. And specifically, the problem is that there is very little safety information that's available for drugs that come onto the market. Moreover, it can take more than 7 years to discover more than half of the serious adverse drug reactions that eventually become associated with an FDA-approved drug. A solution provided by many clinical decision support system and drug-drug interaction companies is to provide alerts to doctors about the information as it becomes published in the FDA labels. The problem is knowledge-based alerts are always out of date. So what? It's a big problem. In fact, the number of lives estimated to be lost due to preventable adverse drug reactions in this country is estimated to be equivalent to the number of lives lost when a jumbo jet crashes and kills everyone aboard every day of the year. That's a lot of lives. And hospitals alone incur up to $30 billion a year of expense in treating preventable adverse drug reactions. The solution is that we need better and earlier alerts. Moreover, we need fewer alerts. Too many alerts causes alert fatigue. The boy who cried wolf, the sky is falling. Doctors become numb to all of the alerts that all of the electronic medical record systems and decision support systems are currently providing them. We need to set up some goals to make sure that those alerts are data-driven and only relevant to the kind of patient being treated. In other words, we need to provide early alerts to important drug safety issues, that is, stop the jet from crashing, but we need to provide alerts that are specifically relevant to the patient. Nobody wants to hear about an adverse drug reaction that's specifically concerning lactating females when you're treating a 70-year-old prostate cancer patient. We need fewer alerts. Eliminate alert fatigue. Moreover, such a system needs to be developed so that it can improve patient safety system-wide, and not just in cardiology or oncology. And lastly, we need to close the loop between clinical decision support and health economics. So, at Lead Horse, we built the Medloom clinical decision support system. And we built that system on the world's fastest database, which is InterSystems Cache. Then, we assigned a team of artificial intelligence experts to look at all of the tools available in the field of AI, and we chose one called Association Rule Discovery. Then we decided to create a research component within Medloom that vets association rule discovery technology through the United States FDA's entire adverse event reporting system database. That is, we created Ardvarc. Ardvarc is truly artificial intelligence, and it supports AI-driven pattern recognition technology in support of early signal detection for improved drug safety. Here's how it works. We embed Ardvarc into our Medloom clinical decision support system and park that in the cloud so that through a pure SaaS model, you can access Ardvarc-driven Medloom decision support with your existing electronic medical record or personal health record system. We do that by making an Ardvarc-enabled Medloom as an embedded web application. To do that, we developed a web services description language, or WSDL, to support that SOAP application that resides in the cloud, so that now, when you pull up George Jones's electronic medical record in your existing system, what you need to know is that the Ardvarc embedded WSDL supporting Medloom clinical decision support captures everything about George, including his age and gender, his background conditions and symptoms, his medical procedures, and his entire meds list, but it does not capture George's identity. Then, all of that captured information is sent up to the Medloom system, which resides in the cloud. The patient's medical profile is captured, their identification is not. And how do we capture all of that information regarding the patient? Through state-of-the-art standards, including XML, HL7, InterSystems Cache or InterSystems state-of-the-art #1 in class integration or interface engine ensemble and CCD technology. In addition, the data that we're capturing includes coded systems like ICD-9 and CPT-4. A SNOMED-based search term expansion technology drives better detection of information relevant to the patient being treated. All of the state-of-the-art standards are used by the Ardvarc-enabled Medloom decision support system. Well, let's say that information's been captured about George Jones, but 10,000 other transactions regarding patients are captured every other day. The Ardvarc system, residing in the cloud, uses AI-driven pattern recognition technology to discover significant associations. What kinds of associations? Well, when we ran the Ardvarc system against a 3-month data set from the FDA's adverse event reporting system coming from the fourth quarter of 2006, for the first time this year in 2010, these were the top 5 discoveries we made. And I want you to focus on the top 3. Number 3 is nephrogenic systemic fibrosis, a body-wide skin rash that has been discovered to develop in patients who have just had an MRI using a gadodiamide or gadolinium-based contrast agent when they have a background of renal insufficiency. The interesting thing is that we discovered in a 10-second run of Ardvarc against that 100,000 case reports from that 3-month data set, the same information that wasn't even published until a year later, following a year of research and a year of publication attempts to get that data published in the peer-reviewed medical literature. Look at the number 2 most significant association that we discovered, osteonecrosis, and this is specifically jaw osteonecrosis in patients taking bisphosphonates. Interestingly, that statistically significant drug adverse event association was published 3 years later than the data set we analyzed, and again, following a 10-second run of the Ardvarc system. But now focus on the number 1 most statistically significant association of any drug combination and the development of an adverse event coming out of an analysis of that 3-month data set from late 2006. Look at that. Breast cancer develops in patients on combination hormone therapy. And when you dive deeper into this association rule that was discovered, you would see that these are in patients that are postmenopausal. Why is that important? It's important because that information was published by the writing group of the Women's Health Initiative 4 years earlier in the Journal of the American Medical Association, emphasizing a huge disconnect between the most common adverse event drug combination association in practice, in experience in the United States in the fourth quarter of 2006, following medical recommendations that were published 4 years earlier. These are the kinds of things the Ardvarc system can discover. And I want you to notice not one of those is insignificant, nor is it clinically unimportant. If, as you say, as I said earlier, you want to drill down deeper into one of those rules, this is the kind of information that's popped up in front of you to see what kinds of patients were involved in the association rule that was discovered. And here I show you how the background information of perhaps 20,000 case reports that supported the discovery of that rule aligned, for instance, with George Jones, who was in question at that time. And what we show you, what a typical Ardvarc rule demographics and statistics can provide you with, are statistics like this. For instance, and this has to do with the association of the COX-2 inhibitor Vioxx, or rofecoxib, with the development of myocardial infarction in patients with a background of ischemic heart disease. You can see that the rule we discovered shows that there is an 85.7% confidence of association linking that drug, which George Jones was on, and the development of myocardial infarction. It also shows that Vioxx alone wasn't in that association rule, but it was shown to occur, to be highly associated with the development of myocardial infarction in patients who are also taking nitroglycerin and lansoprazole, indicating from the nitro in the meds list that this patient did have a background of heart disease. It also shows you how George Jones aligned with all of the statistics in this association rule, with all of the red bars and red pie sections aligning with what George had in his background symptomology in his age and gender. Well, so what Aardvarc AI-based pattern recognition technology can provide is significantly earlier detection of clinically important adverse drug reactions, and it can identify disconnects between regulatory guidance and common medical practice. Case in point, breast cancer and combination hormone therapy in postmenopausal women. Well, Ardvarc, embedded in the Medloom system, has now been applied to support three primary functions: our early warning system, a prescription pre-authorization support system, and an adverse event deciphering tool. And for those, we'll go to the next clip. So I want to thank you for listening to this introduction about Ardvarc AI-driven pattern recognition technology. And for more information on those three primary functions, please go to the next clips. Thank you.